name is Andrew Schroeder. I'm a pulmonologist. I'm based in Los Angeles. I did all of my training at Cedars-Sinai after medical school in New York. Um, although I'm a pulmonologist, I have a special interest in autoimmune disease. I've taken care of a lot of people with lupus. It's an area that I've always been interested in since I was in my training in the ICU at Cedars. I have a long relationship with Lupus LA. In fact, here's a prop. I won an award from Lupus LA back in 2015 called the Medical Visionary Award. It's the only award I keep in my office. All of my other awards are in boxes in my garage. So it has a special place in my heart. I'm always happy to do question and answer sessions about lupus or other autoimmune diseases. I guess that's enough of a bio on me. Let's start with our questions and answers.
Perfect. Thank you so much for your time today. One of the first questions that we received was, how can you tell the difference between lupus-related lung inflammation and something like asthma or a common respiratory infection?
Okay, so this is one of those let's sort it out kind of questions, and I can imagine someone with lupus at home, and they're starting to have symptoms that overlap into all of all three things. So tempo is important. Infections come on quickly, usually. The problem with lupus is if you let an infection go, it gets worse, and then it can cause a lupus flare, right? So that can be a trigger to setting off autoimmune consequences. But obviously, with infections, you're going to have, if it's easy, it's fever, it's mucus that's colored, or it could be brown, or it could be bloody, or it could be your sinus pressure, or it may manifest in a certain area. It may start with a sore throat and then drop down. So that seems like it's a little easier to sort out. I think the question has to do more with kind of maybe I have a cough, I'm short of breath, I'm wheezing a little bit. If you have a history of asthma, obviously, if you're treating your asthma well with inhalers, and sometimes people get shots now, or they even have oral medications, and all of a sudden, boom, symptoms go up. Well, yeah, it's time to contact your doctor. And then the insidiousness of just autoimmune disease itself without being asthma, without being an infection, usually, unless it's pleurisy, it kind of sneaks up on you. So you wade into it. So that's a tempo thing as well. So infections, the tempo is a day or two. Autoimmune kind of sneaking up behind you on cat's feet, that's longer. And then asthma has to be more in the context. Maybe you missed a couple of doses of your inhaler. Let's get you back on your inhaler, see how you're doing. But if you're treating your asthma the way you should and it's not stable anymore, then it's time to look for the trigger. Um, Not a super clear answer, I admit that. If there's questions, you gotta just have a relationship with your doctor and get in there and let them listen to your chest, let them check your sputum, let them take a look in your throat, let them do a good job taking care of you.
Thank you. The next question we have is, can lupus lung issues come and go, or are they usually just chronic once they develop and they stay?
The crazy making part of autoimmune disease is that it comes and goes, right? Like that's why, it makes us all crazy. So you wake up in the morning, you don't know what to expect. Um, with that said, the symptoms may be different from the pathology itself because we have a lot of extra lung. We're overbuilt. We're 12 cylinders. Okay. So you can have issues in your lung coming. You don't feel them until you get across the line, right? And then when you break through, it's bad enough. Now all of a sudden you're getting symptoms. So that's how it kind of sneaks up on you. In terms of, how do you clock it? We need more information. The two best ways of doing it would be pulmonary function tests and imaging. So, do some inflammatory issues come and go, and you can see that on a CAT scan of the chest? Sure, absolutely, they come and go for sure. But what I worry about as a clinician is the kind of under the surface, no symptoms sneaking up on you. So the caveat to this question is, how often should I get checked? at least yearly, depending on what your situation is. If you have autoimmune disease that is a little more aggressive, that would be every 6 months. So imaging, check in with your doctor, let them listen to you, and then a pulmonary function test.
Okay. Our next question is, how does systemic inflammation in SLE lead to lung complications? Are certain types of lupus patients more at risk for lung complications than others?
It's hard to tell. Lupus just picks off an organ here, an organ there. There's a lot of patients with kidney issues who have lupus. I don't see them, right? Because I'm the lung doctor. The kidneys are the organs below the lungs. That's about as much as I know. Um, but you can't, I don't think we can slice it that thin at this point.
Okay.
When it comes to how you take care of yourself with lupus, on a yearly basis, you got to just do the system check and a good physical, kind of the way we do with anyone. It doesn't have to be someone with lupus or other autoimmune diseases, but just kind of do a system check, and be aware that, we need to pay special attention, lungs, kidneys, heart, and sometimes even the GI.
Okay. What's the connection between interstitial lung disease, like ILD, and lupus? Is there a connection?
So, yeah, there are some patients with lupus who develop ILD. It's not at the top of the list of autoimmune diseases that causes interstitial lung disease, which basically is fibrotic changes in your lung. The problem is our lungs are delicate. They're, the airway separates 17 times. There's 17 divisions by the time you get to the bottoms of your lungs. That
Okay.
means the airways are teeny tiny, very delicate. Blood and air are interfacing. Um, if scar tissue builds up, it takes like a chunk of lung and it turns into a scar. So you start missing lung. So it eats up lung. And then it causes areas that are kind of these big, big open spaces, which are great places for infection, right? So it's just not good because it collapses lung, it forms a scar, it takes away your ability to transfer oxygen, and then it leaves these areas that are prone to infection. So obviously we want to avoid it. Um, Scleroderma is another autoimmune disease that I worry about. Those are people who really do, you can kind of bet on the fact that they will develop interstitial lung disease at some point in their course. It's not a guarantee with lupus. What I worry about in a lupus patient is they come in with symptoms. We do a CAT scan. We see active inflammation, which the radiologist will call ground glass opacities. That does not mean the lung is cooked, it's not scarred, but it's inflamed. We need to stop that inflammation before it becomes a scar. Okay. So if inflammation hangs around long enough, it can become a scar. The other way to get a scar and this is outside of lupus, is just to have an infection that chews up some of your lung. Then
Mm,
you end up with more scars. Then that's not ILD per se, where it's just this pervasive thing that where you look at a scan and it's in both lungs, but it creates these areas that are more prone to infection. And then when I know those are there in the lung, I have to treat the patient differently because they're prone to different types of infections and you have to be more aggressive. So to recap, lupus is not a guarantee you're going to get interstitial lung disease. It's still a risk. You still need to be on the lookout. The way to isolate it or diagnose it early would be with a CAT scan. And you can also use pulmonary function tests, which are actually a little more sensitive, but you really have to know what you're looking at when you look at those numbers.
wow, thank you so much for all that information. That's super helpful. The next question says, how does pulmonary fibrosis get created in lupus, and are there early warning signs?
Right. So that's kind of what we were talking about before.
Mm.
So unchecked inflammation can become scar tissue. So it starts out with symptoms like shortness of breath, heavy lungs, it's hard to breathe. I feel increased work of breathing. My exercise capacity is going down. Okay, that's a heavier lung. It's inflamed. We pull our lungs open. Our lungs don't have muscles. It's the muscles in our chest wall and in our diaphragm that get our lungs to move, right? So if they start to feel heavy, you look with the CAT scanner, you see this ground glass opacity, these marks of inflammation in the lung that are usually patchy. That's when I get a hold of the rheumatologist and I say we got to treat the underlying disease, right? We got to go after it a little harder because if you let it sit there long enough, it It's not a guarantee, but there's a likelihood and a risk that you don't want to take that it will collapse into that scar tissue, which is pulmonary fibrosis.
Wow. Okay. Can mild shortness of breath be an early sign of lung involvement with lupus, or is that not something that would prompt a workup, or would shortness of breath be something that should prompt a workup?
Yeah, I mean, look, shortness of breath. I remember when I was a med student, and I was looking at when you take a history and someone says they're short of breath, like what can it be? And then I'm like, oh my God, you have a big freak out brainstorm because shortness of breath can be like 50 million things. And then you make a list and you keep it in your pocket and you walk around the hospital and you like wait for someone with shortness of breath and you go down the list, right?
Yeah.
So yes, it can be your lung. The problem with shortness of breath is it could be your heart. It could be the fact that you're deconditioned. It could be the fact that you're anemic. Okay. So it could be bloodborne issues. It could be other organs, or what I see a ton in autoimmune disease, more often than not, especially when we're doing PFTs, is the chest wall doesn't want to work, right? The chest wall's stiff. So I can't tell you how many times I've told patients, you know what, your lungs are great. Lungs are perfect. It's what's around your lungs, right? So the chest wall doesn't want to move. The connective tissue is not happy. Our ribs connect to our spine. There may be some arthritis there. The ribs don't move the way they should. And that translates to shortness of breath. So there's no easy answer to shortness of breath. Could it be the beginning of bad, terrible lung disease and you're going down the tubes? It could be, but you need a wider net. Okay. It could be as simple as anemia, could be the chest wall, it could be a lot of other things.
Wow. It's really
Like
like,
brainstorm, right?
yeah, for sure. Um, our next question is, does lung involvement with lupus increase your complications for respiratory viruses like RSV or COVID?
Yeah. No, I live in fear of that for sure. Because the lungs self-clean. The lungs protect themselves. They're an upside down tree, right? So the airways need to taper because there's just this kind of escalator of mucus where something lands in mucus and it just gets escalated out. Bye bye, thank you. Not going to cause an infection, right?
Mhm.
If your airways are have a poor shape, they're scarred, they aren't the right, they're not moving like the escalator should, that's when you collect viruses and bacteria and then it doesn't leave. So it's all about self-cleaning and protecting itself. And I worry about that, especially with autoimmune players, because right, your immune system's there. It's like too aggressive here, it's hurting you. And then all of a sudden you get an infection and it doesn't do a great job protecting you. And don't forget the medicine you're taking, right? You're taking medicine that blunts your immune response.
Yep, so true. Um, are there any non-invasive tests that can monitor lung health over time or in lupus patients?
I mean, look, everything I just talked about, for sure, you
Mhm.
know? So CAT scan's non-invasive. Pulmonary function tests are non-invasive. The invasive lung test would be a bronchoscopy where we take a little camera and put it up your nose or through your mouth and it goes down in your lung. Um, that's when we need a sample to culture, or we're looking at a mass or something that we're worried about and we get a little piece. But everything up until I started talking about bronchoscopy is non-invasive.
Perfect. Um, we have a question here that asks, is there any relation between lung involvement related to lupus and sleep-related breathing issues like apnea? And do they affect each other?
Yeah. Yeah, I mean, when I was training in pulmonary, I was forced to go through sleep medicine fellowship too, because we somehow I signed up for that and didn't realize it when I applied to become a pulmonologist. So I had to go to the sleep clinic every Wednesday at the VA for like 3 years. So, why are pulmonologists involved with sleep medicine? It's because sometimes the sleep disorders are pulmonary, right? Because sleep apnea, you're not breathing, there's a blockage, and it blocks off your airways 60 times an hour, and then you don't feel good during the day. Surprise, surprise, right? So, is sleep are lung issues during nighttime going to hurt you in the daytime? Yes. right? So sleep apnea will, everyone knows that. What can really do you in at night is if you have reflux, okay? So if you're refluxing stomach acid into your lung at night, that's horrible. That chews up your lung. We actually can see on CAT scans, a radiologist will make a comment like this location in the lung is very indicative of people refluxing into their lung at night. So if you want to pay attention to one thing that could improve your life, if you're worried about sleep, is be aware of whether or not you have reflux. Okay. So signs of reflux are the obvious heartburn. You can also wake up with a sour taste in your mouth in the morning. You can also suddenly wake up when you reflux at night and it hits your vocal cords, you bolt up. Boom. Okay. Like you're upright and you're coughing. So there's different ways of waking up, but waking yourself up with reflux at night hitting your vocal cords is a bam. Okay.
Mm.
If that's happening to you, get it looked at, treat it, because the last thing you want to do is spray acid into your lungs every night. It makes them unhappy.
So helpful. Are there any lifestyle changes that you recommend to your patients to help improve lung function, if they have lupus or have inflammation related issues with their lungs?
Yes, and they're all very boring, and people just kind of start to not pay attention.
Noted.
Okay, it's a huge downer because it's the same thing that everyone always says, right? So don't eat right before you go to bed. That's the reflux stuff.
Okay.
Please get some exercise, move your body. There's no special exercise for lungs. The only exercise that I recommend is the one where you breathe more. Okay. So, depending on your situation, that could be on a machine, that could be walking around, anything that gets your respiratory rate up. And there's two reasons for that. There's three reasons. One, chest flexibility. Two, muscle improvement in your chest while maintaining muscle. And three, helping the escalator inside your lung that self cleans, helping it get that stuff out. Okay. So exercise and then actually getting sleep if you can. I know it's hard to get sleep, but actually, you know, having good sleep hygiene, stay off screens before you go to sleep. Don't pay your bills right before you go to sleep. Just do things where you mellow out, and try to get rest, exercise, and obviously good nutrition that plays into reflux as well.
Yeah, that makes sense. The
So
usual
boring.
suspects.
I wish it was just a shot or a pill. It would be easy, but it's the hard stuff.
For sure. We also have a question here about pleurisy and how it's different than pneumonia and can it be misdiagnosed?
Yeah, pleurisy is horrible. I hate it. It's called the devil's grip. That's what we used to call it because it's like the devil grabs you. So the inside part of your chest wall, not the lung, but like the inside of the cavity, for reasons I don't understand, has a ton of nerve endings. It's so tender. So, like, anytime I'd ever have to cut into that area for a patient, I would use almost a whole bottle of lidocaine, boom, all over the place because it's super tender. Those are the nerves that are firing when you have pleurisy. So, pleurisy is inflammation of that lining and maybe the outside of your lung. So it has nothing to do with your lung, but it's so horrible. It's like you take a breath and you almost want to stop breathing. It like stops you from breathing, right? So if
Mhm.
anyone's had pleurisy out there, you know what I'm talking about. That's pure inflammation. That's like textbook autoimmune. I've seen a million patients with pleurisy. I end up making a diagnosis of lupus based on the fact that someone thinks they're totally fine and they come to my office with pleurisy. I do the testing, boom, the pleurisy is because of lupus. Okay, that happens, with regularity in my practice.
Wow.
So, how do you treat it? You treat it with steroids, you treat it with painkillers. You have to be super aggressive because the problem is you don't want to breathe and you do what's called splinting, right? So, like that part of the lung, you're just not really breathing and then it doesn't self-clean, and then you end up getting pneumonia in your lung.
Wow.
So that's why we have to be aggressive in treating pleurisy. And then pleurisy is another signal where I say, hey, I just got a signal. We got to like talk to the rheumatologist and start treating the underlying issue a little better.
Sure. That makes sense.
Yeah.
Um, we have another question here about pulmonary hypertension, asking if that's common for lupus.
Not terribly common.
Okay.
It's a terrible disease. And I think just like one comment on pulmonary hypertension,
Sure.
there have been tons of advances. There was a point when I was recertifying, keeping all my credentials and everything. You have to take a test and all that stuff. And I'm reading about pulmonary hypertension. And I just basically came to the conclusion, if you have pulmonary hypertension, you need to be at a major medical center and have a team. There are literally teams where it's a cardiologist, a pulmonary, anyone else they need to like truly understand why you're having that pulmonary hypertension because there are a lot of reasons. But that's team approach. Don't just go to your regular local pulmonologist and expect high quality care. There's too many things that need to be figured out when you have pulmonary hypertension.
Okay. Thank you for that. The other question that we have here related to remission is asking if it's possible for lupus-related lung inflammation to heal or to go into remission. Is that possible to kind of have
Yeah,
recovery? Is it sort of a
absolutely.
decline once it starts?
No, that's amazing. Yes, 100%.
Oh,
So there are times when we just monitor, right? Yeah, I love it. That's like a gift. I wish everyone went into remission and, everything just kind of sorted itself out. But yeah, I've definitely seen it.
oh, nice. Next question is, are there any supplements you recommend to your patients that have lung involvement and struggle with lupus? Does vitamin D or omega-3s help?
I mean, I think, look, we're always pushing vitamin D for autoimmune for a million reasons. You can think of vitamin D almost like a hormone. Okay. So it does so many things in the body. So I'm selling you vitamin D. If we're just talking about the lungs, yeah, that goes under the vitamin D umbrella. Omega-3 fatty acids have been shown to help a million things, but it's more cardiac. But once again, I'm selling you that, right? That's just so easy to take, and you get so much bang for your buck. In terms of the supplement that I find myself reaching for with lung patients are the patients who come in and they say, my mucus is too thick. Like I feel like I'm gummed up. No matter what I do, like I just can't move mucus. There's something called N-acetylcysteine or NAC. So NAC, it's available without a prescription. You can find it on the internet. The kind of accepted dose is 600 milligrams a day. It comes in a capsule, and that's a mucolytic. It kind of like thins out mucus. So if thick mucus is your problem, I tell people to reach for that NAC or NAC, N-acetylcysteine.
Okay, awesome. Um, do we have time for one more question, Dr. Schroeder?
I have all day.
Great. We had someone ask about immunosuppressive medications used in lupus and if it affects your lung function over time. I think you kind of already touched on this, but can you just share a little bit about the relationship with immunosuppressive medications? And
Sure.
you mentioned the cleaning a little bit.
Sure. So if you're just looking for side effects, there, lupus meds they're not at the high end of the list when it comes to just lung damage per se, because you're on a certain medicine. There's other medicines out there for sure that we give for other issues. I'm not talking about autoimmune where we have to worry. There's some things that cause there's some things that cause pulmonary fibrosis just from the medicine. That's not lupus medicines, okay? The only kind of two-step process that can happen is it makes it hard to treat infections, right? You just don't want to have chronic infections in your lungs because they remodel, they get scarred, and then you get these little areas that are more prone to infections because they don't self-clean.
Yeah, that makes sense. Okay, we'll do one more question, or maybe just two more. Can Sjogren syndrome, when overlapping with lupus, increase lung dryness or risk of infection?
Yeah, it does. And I've seen it. The issue is dryness. So it starts in the mouth because when your mouth is dry, you get weird bacteria. So those are patients who I tell them they need to get their teeth cleaned every 3 months, and
Wow.
that's a real thing. And dentists obviously key in on that too, and the dentist will reiterate the same thing. So, the bacteria you're exposed to are different, even starting at your lips. And then not having sheets of normal mucus that we make, that clear mucus, not having as much of that really makes it hard for your lung to self-clean. So that's also a real thing. So how do you combat that? You keep cleaning your teeth, keep moving, okay? Because that enhances the self-cleaning of your lung.
Wow, that is so interesting. Thank you. Um, when should a lupus patient be referred to a pulmonologist if they're reporting symptoms of, breathing, things like that? When do you think that you should see a pulmonologist?
I mean, look, at the first symptoms, because you just need to know the lay of the land, right? So you get the terrible diagnosis of lupus. You don't know what lupus is. You've heard about it. You know it's bad because you only hear about bad things anyway. You don't hear about the lupus patients that are just kind of mild and may just go into remission, right? Those aren't the people we hear about. So when I say get the lay of the land, that means, do the check, bring it in, check all the levels, right? Check your kidneys, check your, abdominal stuff, check your lungs, check your heart. So get a scorecard or kind of a dashboard of what are we worrying about. And, that could be a one and done at the pulmonologist. I love that, right? You're fine. It was nice to meet you. If you ever have issues again, please let me know. But it's worth a single check. So what would the single check be? It would probably be imaging, as simple as an X-ray. We're better off with CAT scans. And then a pulmonary function test. Check the airflows, make sure the diffusing capacity is normal, you're getting oxygen nicely, and just like get it crossed off the list, hopefully.
Awesome. Thank you so much, Dr. Schroeder. We really appreciate your time today. And for anyone listening, we have a few other Q&As that Dr. Schroeder has done that have been really interesting. So we'll link to those in the caption. And you can just check out the link to sign up to see when we're going to have future talks in the caption below. And thank you so much for your time.